So I don't think people really understand how important this conversation is and the peace of mind that can come from having it.
Mom and Dad were always, not always, but it would come up in conversation. We're getting older. You're going to be the one that's going to be doing, taking care of me.
People have got to talk about it. From my perspective, with my brother, for example, because I had talked with him in depth about what his wishes were, even though I could never get him to do a 5 wishes or, his director for anything. I could never get him to sign anything. I knew exactly what he wanted.
Somebody has to start the conversation, and then you have to tell your providers what the wishes are. So just do it. It's hard, maybe it's easy. And afterwards, people have such a sense of relief. So the more you do it, the more positive feedback you get, because people are so appreciative that they have these conversations. So it's worth it.
It was important to make him the most comfortable, and I knew that he would be the most comfortable in his home, and it was his wishes that he had expressed to me that he wanted to stay in his home.
We're going to talk about advanced care planning, or as I like to call it, planning before we pass on. And this is planning for ourselves and planning for our family. What most people don't realize is after they pass on, many people leave a messy situation for their families to resolve. And if they could take the steps before that, while they still have decisional capacity, if they could take the steps to do advanced care planning, they make life easier for themselves because their wishes get carried out, and also their families don't have to suffer through the process of figuring out what they wanted.
Aging and death in and of itself needs to be destigmatized, right? Is not necessarily a bad thing, either one of them. And we need to embrace and understand that death happens, and wouldn't it be better for all of us to experience a good death rather than a traumatizing bad death?
Whenever it spread to his pancreas, his doctor kind of told us that we needed to start really planning things, and none of us really thought about it. We had to really start making decisions, even though we weren't quite ready to.
When I was given the opportunity to do this, I avoided it like the plague. And I didn't realize that shortly after that, I was going to be put in the position to make healthcare decisions for somebody else.
And it's when the patient has to fill out their own advance directive and appoint their own healthcare surrogate. And you have to have these conversations when they can make those decisions. So
this is really about what matters most to a person, and being able to share that with their loved ones and with their healthcare providers, and then documenting that into different forms so it can be honored if the person's unable to speak for themselves.
If you've had these conversations with your loved one, it's just to tell your doctor, tell the healthcare team, hey, we've had these conversations. This is what my husband wants. This is what my mom wants. And just get it all written down right off the bat. And so the patient themselves can do their own advance directive, but if it's too late and the patient can't make their own decisions, the family and the healthcare surrogate can fill out a MOST form, the medical orders for scope of treatment. So we have the capability to do it anytime, anywhere, any place, but the earlier, the better.
These are documents that you can talk to your facility about. They can help you with giving you some things to reflect on, to really think about what you would want and who in your life you should share that with, but definitely your loved ones, definitely people on your healthcare team.
But once you begin to talk about it, because it's something we're all going to be there, we're not going to avoid it. And to think about it, you could put yourself second and put your family first. And say, okay, I am going to have this conversation because this is what I want for my life.
My husband and I, we have a trust. So within our trust, we have, reviewed and signed all the documents, the advance directive, DNR, living will. And we've also attempted to talk to our children about our wishes, because we have identified, if something happens to both of us, or if something happens to one of us first, and then the other one later, we talk to them about who we've designated to make decisions on our behalf.
It's a blessing to have these conversations. The family feels so much better. The patient feels better. It's like a weight has been lifted.
You might think, I don't we don't have to have the conversation yet. And it's scary because you don't want to think that anything's going on with your parent or loved one or anything like that. But if you have the conversation sooner, it really does help.